Hi there, everyone. So glad you could join us today as we journey through the pages of another informative weekend edition of Jamaica Magazine. I'm your host, Adrian Atkinson. We'll be exploring a partnership to make our children safer. Plus, Healthwise looks at medical treatment for children with spasticity and accessing prescription drug through delivery service from your NHF pharmacy. Still to come, help to start, expand and grow your business. Sit back and relax with these and more interesting features right after this important message. The job of protecting and ensuring the safety of children is the business of everyone. This work includes making our community spaces and roadways safe for them. Here is a look at a partnership that is helping to create this safe environment for our children on their journey to and from school.
Safe Passage Project is an intervention to support the safe commute of children to and from school using specific roadways and thoroughfares. Road safety is a national cause for concern, as hundreds of Jamaicans, including children, have lost their lives annually due to road accidents.
The police and citizens do welcome the Safe Passage Project. This project is not only beneficial to our youngsters, but by extension, the community.
The project has already been implemented in 8 schools across Jamaica under the first phase of the Integrated Community Development Project, ICDP, which was funded by the World Bank. And building on the success of Phase 1, the Safe Passages Project is now being implemented under the Government of Jamaica's ICDP-2 project in 5 communities: Salt Spring and Anchovy in St. James, Treadlight in Clarendon, Greenwich Town in Kingston, and August Town in St. Andrew. 3 of these safe passages, including within Salt Spring, are Government of Jamaica targets under the EU's Citizen Security Program for financial year 2021-22.
We are here in this ceremony to hand over a safe passage. And let me tell you that indeed when we help the government to implement the Citizen Security Plan to make sure that children can go from the 2 places in their life which should be, where they should be safest, between home and school, one cannot say that that is not contributing to citizen security and to their well-being. So I'm extremely happy to see that we have included interventions like this in our support. It is not just a road safety project, it's a community project where everyone gets involved.
The project does not stop with the infrastructure. It also includes a comprehensive public education and road safety program targeting staff and students, residents, transport providers, and other road users by educating them on proper road usage.
It is my hope that this Safe Passage Project will attract other stakeholders to build on this foundation.
This safe passage in Salt Spring boasts all the features which have become synonymous with the project. At a cost of $14 million, 400 meters of sidewalk was constructed with safety guardrails. School traffic signs were installed already, and a pedestrian crossing was put in place. Additionally, 2 bus sheds were constructed. The school fencing was rehabilitated and replaced with a block wall structure, decorated with murals depicting messages on road safety. It is my hope that this Safe Passage program will have the outcome of providing safe commute for students, staff and other pedestrians in partnership with the wider community and other stakeholders.
up.
Girl, me just get someone for jury duty, but me don't want to have anything to do with courthouse.
This is your chance to help someone get justice. Plus, you can learn about the court system and serve your country.
And since when regular somebody like me get called for jury duty?
Well, once you're between 18 and 70, your name is on the voters list, or you have a TRN, them can summon you.
Contact the Court Administration Division for further information at 876-754-8337 or visit the Supreme Court website at www.supremecourt.gov.jm.
Brought to you by the Justice Undertakings for Social Transformation Program, a project funded by Global Affairs Canada.
Children that have become disabled by a type of muscle stiffness known as spasticity are able to receive treatment that may restore normality or significantly improve their quality of life. Follow us now on this next journey to explore the life-changing possibilities.
A mother or father's wish for his or her child. That he or she is happy, healthy, able, and will achieve his or her full potential. Even in the face of disabilities, these aspirations are affirmed with extra care and the outpouring of love in support of children with special needs. And the children themselves, some not able to freely move due to a condition known as spasticity, have strong faith in their abilities. Spasticity, or muscle toning, is a type of muscle stiffness seen in children with neurological conditions such as cerebral palsy.
Cerebral palsy is a name that describes a group of conditions where there's injury to the brain, the developing brain that occurs during pregnancy, in utero, at the time of delivery, or up until 3 years old. And it affects a part of the brain that controls movement, the motor section.
With the varying degrees of cerebral palsy, some children may have issues with comprehension or understanding. Others have seizures and problems talking, swallowing, hearing, or seeing. Despite the struggles, the possibilities are bright for children living in Jamaica with this and other conditions that affect the ability to walk. Medical interventions are now allowing some disabled children to walk for the first time and for others to walk better, ultimately having an improved quality of life.
I think what we have brought is a comprehensive approach to addressing the problem, where all the medical professionals, including nurses, physiotherapists, occupational therapists, the surgeons, the rehabilitation and specialists and physiatrists, and the neurosurgeons and neurologists have come together, working with the hospital, working with the pharmacists to try and solve the problems of each child individually. So it's not a one-size-fits-all. So for example, in my specialties, some of them may need a surgical procedure on the lower back, which we call a dorsal rhizotomy, where we will resect some of the nerve or divide some of the nerves to allow them to move the legs more freely.
Other options for treatment include injecting the muscles or around the nerves with medication that decrease muscle tone or muscle stiffness. These medications include phenol or botulinum toxin type A, Botox. Specialist teams at the Bustamante Hospital for Children and the University Hospital of the West Indies, along with partners from overseas, have been pioneering treatments for these children.
The children are assessed. They're assessed by the physiatrists, they're assessed by the physiotherapists, and a diagnosis is made, and then a particular treatment is prescribed that's tailor-made for that child's disability.
Assistive aids such as braces, walkers, and other orthotic devices provide important support to children dealing with spasticity and the pain or discomfort it causes.
It's important for children with movement problems to be positioned properly. Without good positioning, the stiffness can pull the joints out of alignment. And so when they're very early, we put them in what we call braces or orthotics. And these orthotics will maintain a proper alignment of the joint, preventing the ankles from being deformed, preventing the fingers from being deformed.
The braces help with standing, balance, and overall mobility.
If you start from toe upwards, you have what we call ankle-foot orthosis. AFO is the quick acronym. You have orthosis or braces that includes the knee, ankle foot orthosis that allows for stability. You have some that we use at the hip to keep the hip apart. We use some at the elbows as well, or the wrists, so wrist orthosis. Some patients may require spine orthosis. Those are not usually used in the neuromuscular children, meaning the children with cerebral palsy and weakness. And if they are able to stand and balance, they get walkers to ambulate or wheelchairs so the parents and caregivers can carry them around comfortably.
There are several risk factors for cerebral palsy.
The risk factors include poor antenatal care. It also includes children that are born very young, premature delivery, less than 28 weeks, because the brain is very delicate, and any changes in oxygenation can affect the brain. Low birth weight as well, when children are born very low. Different types of infections can cause it.
And even after delivery, there's the risk from head injury and infections such as meningitis and jaundice, among other things. Doctors say the risk of developing cerebral palsy can be minimized.
Parents need to know that you must have proper antenatal care, proper enough to take the pregnancy to full term, to 40 weeks, so the child's brain and body and blood vessels can develop properly. In addition to that, good health care condition for the mother, and delivery, safe delivery is always important, and postnatally, meaning after they're delivered, is to ensure that the children are healthy, they get their vaccinations, they're not exposed to any infection, there's no trauma to the brain, environment is safe, so you don't have exposure to chemicals that can also cause it, or to accidents or near drowning and stuff like that.
Children's exposure to toxic chemicals such as paints with lead in them, herbicides, pesticides, or household chemicals with pungent odors, either ingested or inhaled, can cause brain damage and must be avoided. Our best option for good health is always prevention, but that aside, effective curative measures offer hope and great joy.
We do have children walking who weren't able to walk before. We do have children sitting who couldn't sit before. I had a patient once where the legs were crossed, scissored we call it, where the legs were scissored at the hips, and the mother wasn't able to clean her properly or carry her. So when she used to carry her in the front. So we injected between the legs, and she came out. She was very happy. I'm like, why are you so happy? She's like, me can lap her now. I said, what do you mean by that? Because we injected between the legs, she could open the legs, so she could now carry her on the side, one foot in the front, one in the back, and a bag.
We hear of another story from Aunt Avia, who cares for her nephew Emilio.
His name is Emilio Morris. He's 12 years old. At one point, his foot was like turning like this. So now the car seat at the Bustamante, it said come back around straight. So now he's wearing a braces. At one point he used to creep, but now he doesn't creep. At one point his knee was very tight, but now it's not so tight. Things kind of better now, being that him get the injection. He used to get fizzy. They want him to stand up in the brace.
Kenil Baker is 13 years old. He was born with cerebral palsy, low motor skills. Basically, he cannot walk without assistance.
We have been coming to this clinic for some time now, where he has gotten injections and has done a surgery, which has helped him tremendously. He could not lay on his stomach. After the surgery, he was able to lay on his stomach and turn over, roll over. He's able to stretch out his hands and legs. And for bathing him, it has been made much easier for caring for him. He could not feed himself. He's trying to feed himself now. Well, you can leave him with food and he will feed himself. He's a very happy child. And we have good support from family and friends. And thank God we do. He's our joy. He's our joy.
What a way you're full of roots and culture. That was in Jamaica 60. Jamaica 60? What a piece of news, Miss Matty. I feel like my heart going bust up. Just in, the island of Jamaica is on the verge of celebrating its 60th year of independence. We have to celebrate it. They say the people them, them come here, you know. But you see, when our people decide, say the other people them free paper, burn up. Them say if it's war, start it, whatever. We all collect medal, panta fight, you know. Medal. Amount of tongue we give them, you know. The celebrations are slated to begin on January 1st, 2022. Organized by the Ministry of Culture, Gender, Entertainment and Sport. We have more in this report. I am on site and planning activities are ablaze. Persons are advised to download the Reggae Jamaica app to know what it activities for the Jamaica 60 celebration. If you don't know the app to get the updates then.
We are continuing our health journey, turning the corner now to look at the NHF's prescription drugs home delivery service. This, along with other offerings, is helping to reduce waiting time and overcrowding at NHF pharmacies and improve patient care for the elderly. Let's follow them and make a delivery.
Senior citizens in the cohort 60 years and older represent the fastest growing demographic segment of the society as more people are living longer. This changing dynamic has prompted the government to ensure improvements in the level of responsiveness to new expectations and needs of our seniors. The need for quality healthcare is top of the list. One aspect of quality healthcare service is the prompt access to affordable medication. So the Ministry of Health and Wellness, through the National Health Fund NHF, has been leading the government's charge in providing critical supplies of medication at subsidized costs to persons in need. That includes seniors. The NHF has been improving its service by employing ingenious means of delivering medication and reducing waiting times and overcrowding at prescription outlets.
We are using a number of services in order to make it easier for our customers. We have the Prescript mobile app. We have a drop-off and pick-up service. We have scheduled refill for persons who come to the pharmacy frequently with the same medication. And we have a number of other initiatives in which we contact clients to work out easy ways for them to receive their medication.
A home delivery service for drug-served patients 65 years and older is the NHF's latest addition to its offerings. This emerged as a response to the coronavirus pandemic.
As most people know, the NHF is a customer-centric organization, and with COVID-19 we actually looked at different ways of better serving our customers. Medication delivery is an idea that we have had under active discussion for a number of years, and we found that this was an opportune time to implement this service.
This new service is available to drug-served patients on the NHF's scheduled refill program who have monthly appointments to pick up their medication at a drug-served pharmacy.
For these patients, we give them 2 months supply of medications, basically. And the feedback is just excellent. It's really great. But when you look at how grateful they are, because some of them they can't walk, some of them they're disabled in terms of hearing and so on. So when you can come to them to actually give them their medications, it's really heart-touching, basically. So and they're very grateful. They say it all the time, and they are loving the service as it is now.
This was started in St. Thomas, and we've expanded into Kingston and St. Andrew, as well as in St. Catherine. And other parishes have now started, St. James and other parishes. And the intent is to have this program island-wide.
The NHF's home delivery service is set to benefit approximately 30,000 beneficiaries over 65 years of age, as well as other vulnerable groups that the fund believes can benefit from medication delivery.
We just received a call, asked if we would want it to be delivered, and we readily accepted it. The wait can be very long. I know they try to cut back sometimes by using the schedule thing, but even then, you have to go and sometimes you wait up to an hour. So this is just ideal.
Patients may want to check out the NHF's online avenues, such as web chat, to indicate their need for delivery service. Persons can text their name and their drugstore pharmacy to 876-219-9937 or 876-219-9929. They can also call the NHF at 876-906-1106 from 8 a.m. to 4 p.m. weekdays.
I take the opportunity to commend our pharmacists, our pharmacy technicians and all the team who facilitated this.
This is a good service now. They say must stay at home. And this service that they will come and present a wonderful service.
We are loving the service. We really appreciate it and we wish it would continue.
Customers need not worry about having a National Health Fund NHF card or a Jamaica Drug for the Elderly JADEP card. The service will still be offered.
But at this time, when we come and realize that, oh, probably you don't have a card, what we can do is give you the steps as to how to get the cards. And in order to access the cards, it's a same-day printing at any of our drugstore locations that are named for that service.
The NHF, reaching out, helping to make Jamaica the place of choice to live in good health.
To encourage all Jamaicans to be a part of the My Tree Legacy promotion. Planting trees is important and critical to our survival. It builds resilience. It provides us with air, water, and food. Go out today, plant a tree, renew your environment.
Register your alma mater for the Forestry Department's My Tree Legacy promotion and be a part of the preservation of Jamaica land we love. Let us highlight your contribution to the My Tree Legacy promotion by submitting videos or pictures of you leaving your mark. Every tree counts. Plant a tree today and keep climate change away.
If you're looking to create wealth by owning and operating your own business, you will need the right tools, linkages, and know-how. For that kind of assistance, the Jamaica Business Development Corporation, JBDC, is happy to be of service.
The Newtown Bakery Limited has actually been around for the last 50 years. It was owned by George Chai, and my husband and I bought the business in 2009. We have under that brand Flavor Fresh and Easy Street. When I entered the accelerator program, I wanted to just really expand my mind as an entrepreneur. And wow, I'm pleased to say it did just that. But more, not only did I expand my mind but learn good business practices, I also was able to network with my colleagues, people of the same mind. It's been wonderful.
Earth Essence JA is a manufacturer of all-natural hair care products. So when I say all-natural, I mean the ingredients that make up our products are from earth. The program has actually taken me from a place of not knowing where to knowing exactly where, what, and how I'm going to be able to get there. The JBDC Accelerator program has opened me up to a wealth of information, but not just information. I've met so many persons that have become a part of my network. I've met persons that are in similar fields that are also of similar mind and have created great friendship through it. Through the JBDC program, I've also been matched with a great mentor in a similar field to me, and I've been able to move my business from where it was to where it is today, and I see myself growing to a greater level in the future.
Jerdis Electronic Solution
is a recycling company that recycles electronic waste, corporate e-waste. So we purchase corporate e-waste and we do a breakdown and primarily export the products. The JBDC Accelerator program has been very timely. It has helped to identify gaps in the business operation, and we are currently working on steps to correct some of the challenges that the JBDC team has identified. In addition, we have connected to at least 3 prominent mentors locally who are giving us business advice and direction. There's also a great team of like-minded entrepreneurs who we can always bounce ideas on and have a business relationship. Okay, in the next 2 to 5 years, we're hoping to expand our operation to have at least another branch locally and another branch in one of the Caribbean countries, which we are currently working on.
So my company specializes in information technology in terms of consultation and actually implementation. We're cabling specialists first and foremost, and that is infrastructure, so your network, your PBX, your cameras. We do that, but secondly, we also do technical support. The JBDC Accelerator program has actually helped me to grow the business in terms of development, putting in the necessary structure that we need to grow, and also forced me early on, which I appreciated, in terms of hiring more people to assist, because the business started out as a one person pushing and trying to develop, and putting in, the accounting practices in place, also adding structure in terms of more defined job functions for the staff that we're hiring. In another 2 to 5 years, we want to be on the list of the go-to IT companies in the island. So I started the business by building my reputation, being that ghost or that phantom that is just a whisper. But now we're trying to come forth. So as soon as you have an IT problem, we want to be the forefront on the list of companies that you call.
Starlight Chalet and Health Spa Limited, we're a hotel located in Silver Hill Gap, Blue Mountain, St. Andrew. We're right beside Wallingford Coffee Factory, and what we cater to is the ecotourism sector. The accelerator program helped my company in various sections financially, in terms of it taught me how to review my financials on a more professional scale, how to look on the nitty-gritty of things that I would not really look about. It taught me even business model. I wasn't so sure about business model, but it taught me how to mold my business into a successful business. Currently, our business has been successful because we had retained customers. However, it taught me what else I can do in terms of the marketing. I see my business not just a local brand, but a global brand. And based on this program, it taught me so much, and it opens you to the varieties what the world has to offer in terms of knowledge. Every day you're supposed to learn, and with this program I learned so much. I would recommend any company to join this program, as it will teach you to not think on a small level but on a worldwide level.
This is where we end another wonderful journey through the pages of Jamaica Magazine. We value your company, so be sure to join us again tomorrow for another show. Until then, continue to watch these and other programs by logging on to our website, jis.gov.jm, or subscribing to our YouTube channel. You can also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production team, I'm Adrian Atkinson. Until next time, do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.